Good morning. I'm Nancy Roberts. I am co-founder of Smart Cover Cosmetics, and along with my mother-in-law, Florrie Roberts, we created a line of camouflage makeup and anti-aging products. So today I want to talk to you all about wrinkles. So, as you know, they are a natural part of aging. So as we get older, our skin gets thinner, it gets drier, it gets less elastic. So this leads to wrinkles, creases, and very deep fine lines that can happen in the skin. So what happens, there are many environmental factors that can create wrinkles. So believe it or not, smoking is one of those factors, because you're puffing and you're creating lines, especially around the lip area. Also the UVA rays. So when you're in the sun, the actual sun on your skin breaks down the collagen in your skin, and that starts to create the thinness and starts to create the wrinkles. And also, believe it or not, it's also heredity. So you can, if you grandmother, great-grandmother is in your family, that can also be a factor. And interestingly enough, if you're a certain skin type, so if you are a light-skinned person with blue eyes, you are also more susceptible to wrinkles. So let's think about, now that we know how they happen, let's see how we can prevent them. So the best thing to do every evening is to clean and moisturize your skin, because every day there are so many pollutants that get onto your skin that you really have to deep clean your pores every single night. So that's something to think about. Never go to bed with makeup on, never go to bed without washing your face, because it's very important to have a nice clean skin. And then also, very interestingly, is you should also sleep on your back. Never sleep on your side, because believe it or not, when you turn on your side and you sleep with your pillow, you're crushing your head onto the pillow, and there goes the wrinkles. Your wrinkles go right up onto your skin. So it's better to really try to sleep on your back and get into that habit. Don't smoke. We already talked about smoking as one of the factors. So if you can quit smoking, you're definitely ahead of the game. And then also eat a very healthy diet, because foods enriched with vitamin A, C, and E also can help prevent wrinkles, as well as foods enriched with omega-3 fatty acids. So those are a couple key things to think about. And then, of course, wear sunscreen, because believe it or not, even on a rainy day, you can still get rays through the sun. So it's very important to wear sunscreen every single day under your makeup. And if you're a man, just wear it every single day. It's just very, very important, because men also can get wrinkles. So let's talk about how to treat. So now you have some wrinkles. Okay, so let's think about it. All right, so now what do? We have some wrinkles. Let's think about how we're going to treat it. So a very popular treatment is a product that has retinoid in it. So some people have heard of Retin-A, or they've heard of Renova. So it's a cream that you put on, and then it does, gives you a little bit of peeling. Their doctor will tell you exactly, when to use it, but that's a really good first step of trying to, get rid of wrinkles. Then you can go into some deeper peels, where you use salicylic acid, which is a little bit stronger. And also a lot of women go through dermabrasions, where they kind of sand the skin, but that can also create a lot of redness and sometimes a little bit of scarring. So you really have to go to someone very reputable, like a medical esthetician who's recommended to you, so that you know that this person is highly qualified to do these procedures. Then there's also injections. So everybody's heard of Botox. That's just a big buzzword. So what Botox does, it relaxes the muscles. So a lot of women do it in their foreheads, they do it around their eyes, but then again, you have to do it like every 3 or 4 months. So it depends on, so it's a commitment, so it depends upon what you want to do with that. But then there's also things called wrinkle fillers, like Rejuviderm and Restylane. And they actually, once you have the wrinkles, they kind of can sculpt the cheek area. So, usually a plastic surgeon, or again, a licensed esthetician or medical esthetician will really be able to work with these products and help you. Another idea for getting rid of wrinkles is laser resurfacing. So that kind of stimulates the collagen, which plumps up the skin. And so when you think about doing laser, you should also find out how many treatments it's going to take and how much downtime there is going to be to heal. There's a new thing called ultrasound therapy. The FDA has approved it. It's called ultratherapy, which is a non-invasive technique, and that's to also lift and tighten the skin. And then, of course, if you have really, really deep wrinkles and you've tried other procedures and you really need to know what you need to do next, I would then, think about plastic surgery. So there are a lot of women that, end up doing it, And, if you do it later in life, you only have to do it once. Some people become junkies, and you have to really be careful about that because it can really, transform and change the way you look. So you really have to really be concerned and know that this is going to be a change for the better for you. So that's why you're going to do this plastic surgery. So there's facelifts, there's brow lifts, and you also need to go to a plastic surgeon who has the letters FACS next to it, because that means they're part of the faculty of the American College of Surgeons. And that's very, very important, because a lot of doctors can say they do it, but you really want to have a surgeon that's in plastic surgery and also has an FACS next to them. And also, I would also recommend you finding someone that, someone has used this doctor before and you've seen his work or her work and that they've come highly recommended, because that is a very major step. It's general anesthesia, so it's a very different type of procedure for the appearance of looking younger. So what we were talking about today about wrinkles is that, there are all these different procedures, how to help cover them, how to help to get, stop.
Go ahead.
Okay,
You're
I'm almost at the end. I'm at the end.
Good.
No, I wanted to segue into my makeup. Okay.
Yes.
All right.
Yeah, that was the best.
So, now that we're talking about wrinkles, but there are all these procedures that you can do. So what happens is that we talked about the redness, we talked about there could be bruising even from the injectables, from the Botox. So that's why we have our concealing cream, because we can really augment the different procedures and help you heal. So we talked about that, now that you know all the different procedures, how to, help with the appearance of wrinkles, we can help as a company. When you go for a procedure, you may have some redness, you may have some bruising. So using some type of camouflage makeup will help cover the redness while you're healing. And we have two products that many dermatologists and plastic surgeons recommend to their patients. One is our Perfect Touch Camouflage Cream, and it's very blendable, very, very creamy. A lot of patients like to use this right after an injectable where they have bruising or they have redness. They need to get back to the office and, they put it on. So it's like a very easy, quick fix. A lot of doctors like this, especially even after plastic surgery, because you can't wear makeup for up to 6 weeks. So this is very blendable. It doesn't, dry down to a matte finish, and it's just a very easy product to use. Then a lot of doctors like this, especially when after the plastic surgery and you can go wear wear your makeup. They also recommend using our concealing cream, because it's more of an opaque coverage. You can be out in the sun, you can put your sunscreen on in the morning, you can wear your concealing cream, and you are going to be covered throughout the day, and it's waterproof and you can swim in it, so you can really feel confident in wearing the makeup. So I want to thank you all and have a great day.